Hi everyone and welcome to my channel. I'm Dr. Nancy and today I'm going to be discussing how you can improve your immune resistance. I think immune resistance is a very important thing. It's an amazing thing to have because at least when that time comes around where there's lots of germs that are spreading around everywhere, if your body has good resistance, then you'll find that you don't seem to catch a lot of these things. And also if you happen to catch something, then your body will recover quite quickly and without too many symptoms. So basically I went through a period of time where my body was immunologically not as robust, and then I just did a few simple things that I'm going to be chatting about. I've tried these personally, but they are widely and commonly recommended in a lot of health journals and medical journals and things like that. So I'm just going to be helping you apply these things to yourself. So the first and foremost thing really is just normal sanitation and hygiene. So commonly washing hands. So what happens is the way a virus or a bacteria spreads is somebody comes in with that infection, they might sneeze or cough on a surface or into the environment. What happens is as you walk into this environment, if any of that lands on your face, so obviously you don't want to get too close, that's why we recommend everybody to cough or sneeze in their elbow. But if it lands on a surface, you touch the surface, then you touch your eyes, nose or mouth, or you're eating and you forget to wash your hands, then you can spread that way. So really washing your hands, and the recommendation is to wash your hands for 20 seconds, making sure that you're washing between the fingers and all the way up the wrist, so that if you happen to touch your face, rub your eye, eat, then you're not going to transfer that. And commonly your skin is a good barrier of protection, so making sure that if you do have any cuts or abrasions that you're covering them and you're not picking at them and things like that, and that's really anywhere on the body. So really one of the best ways to boost your immune defenses is exercise. Exercise has many benefits, but this is one of them. So I recommend a little bit of cardio and a little bit of resistance training. They go together because with cardio you're improving how your blood circulates around your system. It helps the lungs as well. If your lungs are healthy, then at least if you do get any upper or lower respiratory tract infections, normally upper respiratory tract infection is like sneezing, coughing, tickle in the throat, that postnasal drip, that sort of thing, runny eyes, watery eyes, that's what's going on there. But what happens is if you've had that for a little bit of time, it can go into the lungs. Then you get the more intense coughing, you can get a dry cough or a congested cough. So if you're getting a good exercise, your lungs seem to have a better capacity, and so you can be a bit more resisted in that. So even if you do get symptoms, you will be a little bit better prepared. However, just having a good cardiovascular system, so heart and lungs, will keep you immune. So the other part of exercising is resistance training. So that's when you're using your muscles against weight or against your own body weight. So you could be doing like push-ups, sit-ups, or holding a weight in your arm, or sometimes I've had my baby in the carrier and exercise, that sort of thing. So you can basically use it in lots of different ways. You don't have to be inside a gym. But what happens is we've seen that in medical research that muscle mass does keep your body resistant to some bugs and bacteria and infections and viruses and things like that. So if you have a little bit better muscle tone, it can prevent you from catching a cold or a flu, and if you happen to catch it, your body can recover and pick up faster. So that's another really handy thing to keep in mind. The second thing really is diet. So diet, commonly you get all your vitamins and minerals from diet. If your diet is not that great, try to improve it because it will benefit you in other areas. But I know for the older populations, like the over 65s, that your body you might not be as hungry as you were previously. Your dietary intake seems to lessen a little bit, so supplements are very handy in that department, where you can just supplement your diet. So things that we're supplementing with are vitamin C, really good for your immune system. Echinacea is a great supplement to take as soon as you catch the symptoms of a cough or a cold. You can take that, or even some people can take it at the beginning of the cold flu season. The other thing that I think is amazing is zinc. Zinc has been shown to lessen the duration of a cough and cold, or an influenza. And also you can find natural sources of zinc. It's commonly found in meat and also in shellfish. You can have non-meat, so you can have vegan sources of it. You can find it in legumes like beans and tofu, and things like that. So zinc is really good, and I like also elderberry extract. It looks like a purple juice and it tastes quite nice, and there is some medical research to show that it can help with reducing the intensity of the symptoms, so if you happen to catch something, but it's also good preventative as well, and it can reduce the length of time that you're feeling sick. And personally, I've taken it. I've found that normally if I might catch a cold that would last about a week, I end up getting it only for a couple of days where I have really bad symptoms. But yeah, some of these things are amazing. The other thing that I really like that's natural is honey, raw honey. So honey that's been heat treated is not effective because it's killed the good microorganisms that help make it beneficial. So raw honey is good, and it's also some studies have shown that it's even as effective as taking a cough lolly. So if you've got raw honey there, you might as well use it, and what it does is it coats the throat and just helps soothe that throat, and it's also good preventative anyway. There's been studies to show that you can't really grow bacteria as well in honey because honey has antibacterial fighting properties. So honey is amazing for a lot of things. And you can even give it to kids. Kids love the taste of honey, and it's nice and soothing for their throats, but keep in mind you cannot give it to children under the age of 12 months because their stomach enzymes are not strong enough to break down some of the things that are in the honey, and it can actually be dangerous and fatal for them. So please don't give it to any kids under the age of 12 months. And also just making sure that your dietary intake is just balanced and healthy. Vitamin D is another one. Vitamin D, you can get that from just exercising outdoors in the sun, or you can get supplements. Sometimes they commonly combine with calcium because vitamin D and calcium help with bone density and things like that. So you can find that quite commonly in health food stores. And always with any supplements that you're taking, please check with your pharmacist and GP, because if you're already on other medications, you may not be able to take some of these supplements, but most of what I mentioned is okay for the general population, but especially for the geriatric population or kids, just check what they can and can't take with the pharmacist. They are usually the main person that has to check and make sure everything doesn't contraindicate, but also your GP, of course. The other thing is really stress management. So stress affects your body in some different ways, in your immune defenses. If your body is stressed, especially long-term stress, if you've been stressed for a long time, what happens is your body starts producing a hormone called cortisol, which subdues the immune response. So your body's not able to fight as readily. It's not ready to pounce if there's a bacteria or a germ floating around near your system. So really trying to manage with stress and putting things into perspective, and I will make another clip about that because I think it is important. It does affect in other areas as well. So if your body is ready to pounce, then even if you're in an environment where there are, people coughing, sneezing, whatever, you'll find that you bounce back a bit better. I remember, as I mentioned, around exam time, we would all get colds and flus, usually just after we've finished the exam. Our bodies just went into mush. So really that's our bodies just being stressed, and then all of a sudden you just get run down and takes you a couple of weeks to recover. So we're trying to avoid those types of responses. Also, as a side note, if you are a smoker, it is another reason to quit, because it decreases your lungs' capacity to be able to breathe and combat any of that if it goes into your chest. If you get a lower respiratory tract infection where there's like a cough, obviously your lungs, they are the main source that allows your body to get a source of oxygen from the air that you're breathing into the blood. So if that is not working properly, you are putting yourself in danger, as well as obviously there's other dangers of cancers and things like that with smoking. So please, if you haven't already quit and considered it, do consider it. There are so many good alternatives and options of different programs that you can try. So that's a really important thing to try to do. And finally, sleep. So obviously, when you're getting good night's sleep, your body's well rested. If your body's well rested, then if there is something that flies your way, then at least you can prevent it. The main problem is also when you do catch a cold or a flu, you will get a few restless nights throughout. So if you already have a good sleep routine, then you're ready to pounce and combat that, and a couple of sleepless nights is not going to bug you. But if you already have poor sleep habits, then you even get into worse. It really can be a bit of a vicious cycle, and it can take people quite a bit longer to recover. Personally, I've noticed this when I've had like young babies and my kids are crying and not sleeping well through the night. They catch a cold, pass it on to me, then we're still all getting bad night's sleep, and it would take a very long time to recover. But as they got older and they were able to sleep better, all our bodies just seemed to get bounced back quite a lot better and a lot quicker. So just keep all those things in mind. They're things that you can get into straight away, especially with the diet and exercise. And always make sure that you're not fearful of catching colds and flus. There's things that happen often. Your body is well equipped to deal with it. Your body, as soon as it perceives one of these things, it will make antigens against it, so your body just starts fighting it straight away. And I find I've had patients with an amazing immune system where as soon as they might catch a cold or a flu, they just get a sniffle in the nose and they're over it quite quickly. I've had that a few times where it's just a sniffle, that something's a little bit not right, and then your body just bounces right back. And that's what you're aiming for. You're aiming to maintain a good healthy lifestyle so that you're not terrified of germs, you're not crazily obsessed about germs and fearful of hugging and touching people and things like that. You are you're relying on your body's natural amazing immune defenses, and they are amazing. And really all we have to do is just look after our bodies and make sure that we're in the right frame of mind, we're not stressed about things unnecessarily, and that you do trust that you're capable of improving your immune defenses. And I hope it's straightforward, and if you can just follow some of these steps and just start a little bit at a time. For example, like if you can only do a little bit of exercise at a time, that's fantastic. If you can do 5 to 10 minutes, it's better than the day before where you did nothing. If you can start to reduce the amount of cigarettes that you're smoking, that's great, because it means that it's less than what you did yesterday. So just little bits, and then eventually you'll just find that you're reaping what you've sown. That's very, very much something that the body offers, where you do reap what you sow when you start to put some time and effort into it. Thank you so much for tuning in. Please, if you have any questions, don't hesitate. And thank you for joining me once again. You take care and stay in good health.